Hello, my name is Olu Ajilore. I'm an associate professor in the Department of Psychiatry. One of the big problems that we face in psychiatry is unclear treatments and how they work for patients with mood and anxiety disorders. We have treatments, but we don't know who would benefit from those treatments. One of the things that we're trying to do with our research is to use neuroimaging and connected technologies to come up with better ways to monitor patient symptoms and to design better treatments for patients with mood and anxiety disorders. Specifically, our lab uses computational neuroimaging techniques like diffusion tensor imaging, task-based fMRI, and resting state fMRI to create network models of the brain and understand psychiatric disorders according to brain network dysfunction, thereby creating new ways of delivering treatments that target these network-based abnormalities. Another part of our lab is focused on the use of smart connected technologies like smartphones and smart speakers to passively, unobtrusively, and objectively monitor users' mood and cognition for clinical purposes. As an example, our lab has developed an app called BiEffect, which replaces the default keyboard of your smartphone with a custom keyboard that allows us to track how the user is typing. And so we can look at things like typing rate, typos, and infer from that information about whether the user is depressed, anxious, manic, and thereby creating an objective way of assessing how our patients are doing. And so we've recently been lucky to get funding to look at how what we're tracking on the phone tracks with what we can measure in the brain, combining the neuroimaging components of our lab and the digital biomarker component of our lab. We're hoping that this type of research could lead to better and more targeted treatments for patients with mood and anxiety disorders. As a graduate of an MSTP program, I found that my training as an MD PhD has been valuable both in my research and clinical work. I've been fortunate to craft a career that allows my clinical work to inform the type of research questions that I ask and to come up with research results that I think will help my patients that I see in the clinic. It's a real sort of privilege to have the opportunity to both see patients and run a lab and see how the results of what I'm doing in the lab can impact the lives of my patients.